Hello, welcome back to our channel, Dr. IKNG. In this video, we'll be learning about another common eye condition known as hyperopia or farsightedness. Okay, so I'll explain exactly what hyperopia is, and then I'll tell you about the symptoms, the causes, the diagnostic methods, the methods or possibility of preventions, and certain complications that may arise if they are not treated. So be sure to watch this video to the end because at the end of this video, we have a very important information for you. We cannot overemphasize the importance of regular eye exams, but the question is, do you do your eye exams every week, every month, or how often? So we are going to tell you at the end of this video how often you should get your regular eye exams, okay? Now, you are new to this channel, be sure to subscribe to this channel so you don't miss our future videos. Ding the notification bell, then you find value in this video, be sure to like it so YouTube is going to know that this video has value and is going to show it to other people. Share this video to everyone you care for and love, and if you have any question, ask in the comments at the end of this video. Okay, now what exactly is hyperopia or farsightedness? First of all, I like to say that when we say farsightedness in this video, we are referring to hyperopia. However, farsightedness also means presbyopia, and hyperopia and presbyopia differ by the causes of these different conditions. For presbyopia, what simply happens is that as we grow older, our lens becomes firm and less accommodative. So objects that are nearby becomes blurry. Whereas in hyperopia, it's a different method, a different cause altogether. So, but what exactly is farsightedness? Okay, so farsightedness is a common eye condition in which you may experience that objects that are closer to you are blurry, whereas objects that are far away from you are seen more clearly. Okay, so what's typical is that um, when objects are, let's say, 6 meters or 20 feet away from you, they appear clearer, whereas objects that are less than 6 meters or 20 feet from you appear blurry. Okay, so that should give you an idea that you're dealing with far-sightedness. Now, what are the categories of farsightedness or hyperopia? They can be categorized in by two methods. First, by the severity into a mild or severe hyperopia. For mild hyperopia, you may be able to see both distant and nearby objects clearly. Okay, whereas in severe form of hyperopia, you may only be able to see objects that are at great distance away from you. Okay, so the other method of categorizing hyperopia is based on the refractive error. Okay, so based on that method, you have low, moderate, or high hyperopia. Okay, so for low hyperopia is plus 2.00 diopter or less. Moderate hyperopia is a range of from plus 2.25 diopter to plus 5.00 diopter, whereas high hyperopia is plus 5.25 diopter or more. Okay, so what are the symptoms of hyperopia? How do you even know that you have hyperopia? There are certain symptoms that you experience. Okay, one of the commoner ones is that looking at objects that are 6 meters or 20 feet closer to you, within that distance, 6 meters or 20 feet, the objects appear blurry. Okay, whereas objects that are distant more farther than that distance appear seem to appear clearly. Okay. Another thing you will experience is that at night you experience blurred vision at night or eye fatigue at night. Okay. Another thing is you have difficulty reading. Okay, difficulty reading. Then when reading, you get to squint to be able to read, or you have double vision when you are reading. Okay, eye strain is also another common symptom, as well as dull pain in your eye. That those are the common symptoms that you experience if you have hyperopia. It's important to note at this point that most children with mild hyperopia don't experience any of these symptoms. They don't even have blood vision. Okay, even when they're looking at objects that are close to them, they don't have blood vision. Okay, why? Because the lens in the eyes of children are very flexible, so they're able to accommodate and they don't experience the symptoms of hyperopia. Okay, so this puts an emphasis on the fact that regular eye exam is a must. Like, it's something you cannot avoid, because if these children go unnoticed, they might develop complications which are actually preventable if you identify or if you diagnose hyperopia in time and treat it. It can actually prevent these complications. Okay, but if you don't identify hyperopia in time and treat it, these children might go on to develop these complications, which gives them more serious eye conditions. Okay, so now what causes hyperopia? Two things. Normally, the shape of your cornea is a little bit curved. Okay, the light passes through your cornea and through the lens and is focused directly on the retina. And the retina at the back of your eye feeds your brain with information, which translates the information and gives back an information that you see as an image. Okay, that's the normal scenario. But in hyperopia, the cornea may be flatter, not slightly curved, which is the normal thing. The cornea may be flatter, or the axial length of the eye might be relatively shorter than expected. Okay, so those are the two common causes of hyperopia. Either the cornea, that's the clear part of the eye at the front, the eye window, so to speak, is flatter, or the axial length of the eye from front to back is shorter. Those are the two common causes of hyperopia. So the next thing to look out for is hyperopia genetic? Well, researchers have come to link certain genetic components with hyperopia. Okay, so what this simply means is that if your biological parents have hyperopia, there is high tendency that you're going to have hyperopia. However, if your biological parents don't have hyperopia, it does not mean that you may not have hyperopia. Okay, so now what's the role of genetics in hyperopia? Now, certain parts, all the parts of our body are formed based on genetic codes, including the axial length of your eyeball. Okay, so if there is any defect in the gene that codes for the axial length of your eyeball, it can actually cause it to be longer, giving you myopia, or relatively shorter than expected, giving you hyperopia. That's on the one hand. On the other hand, on the other hand, there are certain genetic disorders that are associated with severe forms of hyperopia, not even mild forms, severe forms of hyperopia. So whenever you see these genetic disorders, you should be looking out for severe forms of hyperopia. And these disorders include achromatopsia, Down syndrome, or Fragile X syndrome. So any patient who has achromatopsia or Down syndrome or Fragile X syndrome has a high tendency of having severe form of hyperopia. Now, what are the complications of farsightedness. First of all, I want to let you know that these complications of farsightedness are actually preventable. Okay, if you get regular eye exams and your hyperopia is diagnosed in time and treated in time, you may not experience these complications of hyperopia. So why do you wait to experience complications when you can get regular eye exams and prevent yourself from getting these complications, which are actually worse eye conditions than the hyperopia itself? This is also why you should watch this video to the end so you can have an idea of what interval should be getting your regular eye exam based on your age. Okay, so common complications of hyperopia include amblyopia or lazy eyes. These are common in children who have severe hyperopia. Amblyopia or lazy eyes. Another common complication is strabismus. That the eyes look in different directions. That's what's referred to as strabismus. Okay, so it's if these children had regular eye exams and the um, hyperopia is detected in time and they don't become worse, they will not wound up with severe form that will lead to this complication. So it's very important to always get regular eye exams. I really cannot overemphasize the importance of regular eye exams. The next thing to note is how hyperopia is diagnosed. The diagnosis of hyperopia starts with you getting regular eye exams, okay? So you get to see your ophthalmologist, and then your ophthalmologist is going to examine your eye. So if you can read, he's going to use what's called an eye chart, okay? And a device called a phoropter. And what that device is going to do is that it's not only going to diagnose your eye condition, it's also going to provide a prescription for your eye condition, for your particular eye condition. Okay. The other option is if you cannot read an eye chart, the ophthalmologist is going to use a retinoscope to look into your eye and to be able to see exactly where the light that enters your eye forms an image or focuses in your eye. That way, he'll be able to make that diagnosis and give you the appropriate treatment. Okay, very simple and straightforward. Okay, so now what are the management options of hyperopia? There are simple and easy to get options, and there are also surgical options. The simple options include the use of eyeglasses and contact lenses. These two correct hyperopia with the same method. What they simply do, they help the eye to form the image directly on the retina, not behind the retina as you get in hyperopia. Those are very simple and easy methods to apply. Okay, the other options available for treatment are surgical options, and there are two surgical options that are commonly used. Okay, these are refractive surgeries. You can do refractive laser surgery or refractive lens exchange. For refractive laser surgery, a procedure like LASIK or similar procedures can be used. What this simply does is that you use laser to correct or reshape the cornea, so the light passing through the eye will be able to focus directly on the retina. Okay, that's what refractive laser surgery does. The other surgery option is refractive lens exchange. This involves the removal of your natural lens and replacement with an artificial lens or an intraocular lens, and this is going to help your eye to focus light directly onto the retina. Okay, so now, do you really need glasses if you have hyperopia? The answer is not really, especially for children, because as a child, their lens is flexible, and the ones that have mild hyperopia, sometimes they don't present with symptoms at all. They don't have blurry vision at all. They see normally. because their lens is flexible enough to adjust to accommodate it. However, they still need to see an ophthalmologist, okay? And they still need regular eye exams so the progress of the condition can be monitored. If there is any need for intervention or the use of glasses or any other intervention, it should be picked on time, not to be allowed for them to develop the complications that can actually be prevented, okay? So you don't always need the glasses. If you have a mild hyperopia and you don't have symptoms, it may not necessarily need the glasses. But if you have symptoms and your hyperopia is severe, of course, you need those glasses to help you focus and correct your vision. Okay? Can you prevent hyperopia? Mm, there is no proven way to prevent hyperopia. Okay, so unlike myopia, where the eyes have the tendency to grow longer and it becomes worse, in children with mild hyperopia, the growth of the axial length of the eyeball actually diminishes the effect of the hyperopia. However, there are no proven ways to prevent hyperopia by way of intervention. Okay, it's also important to note here that there is no evidence to suggest that eye exercises, vitamins, or pills can prevent or cure hyperopia. So don't depend on them. Be sure to see your ophthalmologist and get proper diagnosis and treatment. Okay. So when can you see or when should you see your eye care provider? You should see your eye care provider if you have symptoms, okay? Or any of those symptoms that I've mentioned for hyperopia, you should see your eye care provider, okay? However, if you don't have symptoms, you still need regular eye exams, okay? And the big question is, how often do you need regular eye exams if you don't have symptoms of eye conditions? Okay. Now, according to the American Optometric Association, for babies, those are from 0 to 12 months, they should get at least one eye exam, ideally between 6 months and 12 months. Okay. For children, they should get at least one eye exam between 3 to 5 years of age. Okay, then children who are older than 5 years of age should be getting an eye exam at least once in a year. Okay, for adults 18 years to 64 years of age, they should get one eye exam at least every 2 years. Then for adults who are older than 65 years of age, they should get an eye exam every year. Okay, these are really, really important for just about any eye condition, whether you have symptoms or not. You should be getting regular eye exams. Okay, thank you for watching this video to the end. I really say that I really appreciate you for watching this video to the end. If you are new to this channel, be sure to subscribe to this channel and turn on your notification bell, okay, so you don't miss any of our future videos. If you derived value from this video, I want you to show YouTube that you derived value from this video by liking this video. When you like this video, YouTube will know that you derived value from this video, and they're going to show it to other people who will actually benefit from this video. So your like is actually good for other people most times, not even you. For you, if you really like this video and you benefited from it, and you have people that you say you love and care for, share this video to them. They will tell you thank you and you'll feel good. Okay. If you have any question, write it at the comment section. Okay. We'll be sure to answer it. We'll respond to all the comments. Trust me, we'll respond to all the comments. If you have any topic, if you have any eye condition that you want us to do a video on in future, write it in the comment section and we'll take note of it and we'll plan a video and do a video and tell you all the things you need to learn about that condition. Thank you once again for watching this video to the end. Take care of yourselves, take care of your eyes, and stay safe. Bye bye.